Assalamu alaikum. I am Dr. Mahmud Tusar, lecturer, Department of Pharmacology in Bashundhara Ad-din Medical College. Today, our topic of discussion is drugs used in diabetes mellitus. First of all, I want to say what do you mean by diabetes mellitus? Diabetes mellitus, it is a clinical syndrome characterized by hyperglycemia due to absolute or relative deficiency of insulin. There are many other classifications of diabetes mellitus, but in our concern, mainly, it can be classified into two types. Type 1 diabetes mellitus or insulin-dependent diabetes mellitus, and another one is type 2 diabetes mellitus or non-insulin dependent diabetes mellitus. Classification of anti-diabetic drugs. Parenteral hypoglycemic agents is insulin and oral hypoglycemic agents. Parenteral hypoglycemic agent or insulin. Insulin is a polypeptide containing two chains of amino acid A and B. It is linked by disulfide bridges. It contains 51 amino acid. In A chain there is 21 amino acid and in B chain there is 30 amino acid. Upon proper stimulation, gene থেকে mRNA থেকে proinsulin, then insulin is released and C-peptide. C-peptide is a measuring, provides an index of beta cell functioning in patient receiving insulin. What are the insulin preparations? There are many insulin preparations. First of all is rapid acting insulin or ultra short acting insulin. Which is insulin lispro, insulin aspart, and insulin glulicin. Another preparation is short-acting insulin, which is regular insulin and natural insulin or soluble insulin. And another one is intermediate-acting insulin (NPH) or neutral protamine hydron, and insulin zinc suspension. Long-acting insulin is insulin glargine and insulin detemir. Now, mechanism of action of insulin. Insulin binds to the alpha subunit of insulin receptor, which causes the activation of receptor and conformational changes into the receptor. This ultimately leads to the catalytic loops of beta subunit come into closer proximity. Phosphorylation of tyrosine residue on the beta subunit, tyrosine kinase of activated receptor phosphorylates different proteins. Insulin receptor substrate, IRS. IRS binds and activates other kinases such as phosphatidyl inositol 3 kinase, which ultimately causes further phosphorylation. This network of phosphorylation occurs within the cell. What are the results of insulin? Results it ultimately increases the glycogen synthase activity, which ultimately leads an increase in glycogenesis. Translocation of glucose transporter GLUT4 into the cell increases glucose uptake, decreased lipolysis and lipogenesis, increased proteolysis and increased protein synthesis, increased DNA synthesis and cellular growth and division. What are the routes of insulin administration? There are three routes. First route is subcutaneous route. Subcutaneous route sites are the abdomen, anterior thigh, buttock, and dorsal arm. And there is another route, intramuscular or intravenous, and another route is inhaled insulin. But most popular route of administration of insulin is subcutaneous injection. What are the indications of insulin? There are many indications of insulin. First of all, this is type 1 diabetes mellitus and type 2 uncontrolled type 2 diabetes mellitus. Diabetes mellitus in pregnancy and all diabetic complications. Diabetic ketoacidosis, diabetic nephropathy, diabetic neuropathy, diabetic retinopathy, and hyperglycemic hyperosmolar state. And diabetes in pregnancy, preoperative and postoperative diabetic patient, diabetes mellitus with severe infection, diabetes mellitus patient after RTA, road traffic accident, and hyperkalemia. There are some adverse effects of insulin. First of all, it causes hypoglycemia or hypoglycemic shock. It causes insulin hypersensitivity, and it causes insulin resistance, lipodystrophy in the injection sites, and insulin edema, obesity, hypokalemia, and alopecia. Now, this is the management of insulin-induced hypoglycemia. Hypoglycemia reactions are the most common complications of insulin therapy. They may result from a delay in taking meal, inadequate carbohydrate consume, or unusual physical exertion, a large dose of insulin. What are the clinical features of hypoglycemia? There are some clinical features, for example, such as tachycardia, palpitations, sweating, nausea, hunger pain, sudden unconsciousness, and convulsions. Now, how will you treat a case of hypoglycemia? If the patient is conscious and able to swallow or take, then simple sugar or in glucose in liquid form. If the patient is unconscious, then we will give honey or any sweet can be given in buccal pouch or in oral cavity. And another management is 20 to 50 ml of 50% glucose solution by IV infusion over 2 to 3 minutes. Or we can give injection glucagon in subcutaneous or IM route. Now, there are some oral hypoglycemic agents. First of all, insulin secretagogues. Insulin secretagogues, which secretes insulin, such as sulfonylureas and meglitinides. Sulfonylureas are tolbutamide, chloropropamide. These are the first generation, and the second generations are the glipizide, gliclazide, and glimepiride. Meglitinides, example, ripaglenite. Biguanides. These are the biguanides are the metformin and fenformin. These are the and then next thiazolidinediones, pioglitazone, rosiglitazone, and alpha glucosidase inhibitors are acarbose and miglitol. Synthetic amylin are pramilintide, and ingredient-based therapies are incretin mimetics, are exenatide, and DPP4, dipeptidyl peptidase 4 inhibitors are sitagliptin and saxagliptin. Now, we come to this sulfonylureas mechanism of action. Sulfonylureas, it blocks the ATP-sensitive potassium channel in pancreatic beta cell. It decreases the outward potassium efflux, and it causes depolarization of the pancreatic beta cells, opening of voltage-gated calcium channel, which ultimately leads to increased intracellular calcium and increased secretion of insulin. Long-term administration of sulfonylureas to type 2 diabetes mellitus reduces serum glucagon level. What are the adverse effects of sulfonylureas? Sulfonylureas causes the most common adverse effect is hypoglycemia in elderly patient, and weight gain, GIT upset, nausea, vomiting, blood agranulocytosis, aplastic and hemolytic anemia, cholestatic jaundice, generalized hypersensitivity reaction, and teratogenicity in pregnancy. What are the contraindications of sulfonylureas? Type 1 diabetes mellitus, pregnancy and lactation, significant renal and hepatic impairment, and in elderly patient, especially with cardiac impairment. Now we come to the biguanides, metformin. Metformins are the insulin sensitizers. Mechanism of action of metformin, it reduces the hepatic and renal gluconeogenesis. It increases the peripheral utilization of glucose. It slowing of glucose absorption from the GI tract. It increases the glucose to lactate conversion, and this ultimately causes lactic acidosis and direct stimulation of glycolysis in tissues and reduction of glucagon level. What are the indications of metformin? Metformin, it is used in, first of all, insulin resistance syndrome, type 2 diabetes mellitus in obese patient, polycystic ovarian syndromes, non-alcoholic fatty liver disease, and treatment of obesity. The last three are the non-diabetic indications. What are the adverse effects of metformin? Metformin adverse effect, first of all, GIT upset, nausea, vomiting, and abdominal discomfort. It causes the decreased vitamin B12 absorption, and then metallictus, lactic acidosis, and this is of all today, for now today. Thank you all.